So I actually started climbing when I started studying for my boards to become a physical therapist, and the two kind of just grew together, and now I see a lot of rock climber patients specializing in their injuries that they incur, whether it's indoors from the gym training too hard or outdoors with falls and other more significant injuries. So a lot of it actually occurs to the hands, obviously just because the strain and stress that we put on our hands with it. Some of it can be tears because your foot may slip off a rock, then all that load goes right to your hands. Other times it's just simple overuse because we love this sport so much that we tend to overdo it quite a bit. So there's two things I'd love to talk about. One of them is we actually have a hangboard when we use our Kaiser rack, so that actually uses pneumatic pressure. So we can use a climbing harness and we can take body weight off of the climbers. So if they have an injury and they've not fully recovered, we can simulate those different holds that they would do, but take their body weight off. It can take up to about 180 pounds off, so we can take quite a large percentage of a person's body weight away. They can then hang on those surfaces and test out the shoulder, the wrist, their hand, see if their body can handle those forces again. So that allows them to train safely to come back to that condition. The other one is actually our BTE, so it's a strength assessing machine, and it's especially great for our external rotators, so I can compare the injured to the uninjured. So I can say, hey, you're still 32% weaker on your affected side than your unaffected. And until we get in that 10% window, I don't want you going back to that because you're at an increased injury risk. So those two machines in particular, they give us great information to see, is the person ready to go back to their sport? Do they need additional training, etc. The biggest thing in the climbing community I kind of just touched on was, people share information within the community, but there's a lot of misinformation out there. And part of it is they don't know who's out there. They don't know that there's someone they can come to and see, hey, this person has this knowledge, because oftentimes the experience is, oh, hey doc, so when I'm crimping on this problem and I'm stemming out my shoulder, I have pain. And that doesn't make any sense to that provider, but that does make sense to me. I know what someone's going through when that happens, so I can relate to that and help treat them more efficiently. So the big thing is for me is just that awareness that we're here and I'm ready to help.